Hey guys, what's good? It's Jay, and I'm back again tonight with another video. Now, I certainly hope that you all are getting on board with me because we are giving you a ton of information that will help you pass the TMC exam on your very next attempt. Now, I have about 15 videos out, and I'm new to this, so they're all not perfect, but we're going to continue to work with this camera and work with the lighting and work with putting out content that you can use to pass the exam. Now tonight, we are talking about pulmonary artery catheters or Swan-Ganz catheter. This information is essential for the TMC exam, things that you must know. Are you ready to go? Let's do this. Okay guys, as always, I'm working from my left to my right on the board. Tonight we'd like to talk about pulmonary artery catheters. And particularly, we like to talk about these two things, the positioning of the catheter and the waveform. And I kind of grew to the best of my ability, sort of a waveform at the top center of the board for you to give an idea as to what you will be looking at on the exam. But the pulmonary artery catheter and the Swan-Ganz catheter, whichever wording you want to use, have a transducer. Now, when hemodynamic measurements are taken, the transducer should be at the same level as the tip of the catheter. If the transducer is placed above the catheter, then you will get a low reading. If the transducer is placed below the catheter, then the reading will be higher. Please remember those two key words, lower and higher, above and below. If it's above, the reading will be lower. If it's below, the reading will be higher, just opposite. A standard pulmonary artery catheter have a proximal and distal port. Okay, we're going to talk about those. Roman number 2. The proximal port measures the central venous pressure. The distal port measures the pulmonary artery pressure with the balloon deflated. The distal port also measures the pulmonary capillary wedge pressure, but then now the balloon is inflated. And we just talked about these because whenever you inflate the balloon on the tip of the catheter to get that wedge pressure or the PCWP, you get the pressure and you immediately deflate that cuff. The presence of a double spike or dichotic notch is normal for the arterial pressure waveform when the pulmonary and the aortic valve closes. Don't try to go searching for something that you don't have to go searching for and on this test for answers. A double spike or a dichotic notch is normal. Now, again, the formula for a cardiac index, I wanted to remind you here. The cardiac index equals the cardiac output divided by body surface area. Normal cardiac index is 2 to 5 to 4. Normal cardiac output is 4 to 8 liters a minute. Make sure you understand that. You'll see both of them on the test. In regard to the pulmonary artery catheter, when passing a catheter and you feel resistance or you feel an obstruction, you should do 4 things. Check air bubble in the transducer. Aspirate or remove the clot. Occasionally they will get a blood clot. Flush the catheter with saline. And number 4, you will rotate the catheter. On this exam, if they say anything about an obstruction or that you feel resistance, I like to suggest that you rotate that catheter if it's one of the answers first. It won't be on the exam, but make rotating the catheter be one of your first things that you do. Now, do not withdraw the catheter. If you feel some resistance, do not withdraw the catheter. It may be that you might not be able to get back into that spot again. And the patient is critical. Whenever we're using pulmonary artery catheters and Swan-Ganz catheter, that means that the patient is actually in a critical situation. But if you do these 4 things, it should resolve the problem on any obstruction on this exam. Now, you must know formula and the normal value for your SVR and your PVR. Systemic vascular resistance, pulmonary vascular resistance. The systemic vascular resistance normal is 1400 to 1600 dynes. Pulmonary vascular resistance for this exam is between 160 and 200 dynes. And I know that some of your review books, you saw how to calculate the SVR and the PVR, but I made a note down here at the bottom of the screen for you to be reminded of this calculation because you will probably see it on the exam. So your systemic vascular resistance is equal to your mean arterial pressure minus the CVP, central venous pressure, over cardiac output times 80. And the time 80 is so that you can get that fraction into dime. The PVR calculation is mean pulmonary artery pressure minus pulmonary capillary wedge pressure divided by cardiac output times 80. And because you time the answer by 80, that will turn your answer into dimes. It's very important that you know the pulmonary artery catheter position in the waveform. Do not forget this information in the middle of the board when it comes to the proximal port and the distal port of this catheter, because you will see these. Know what a double spike and diastatic knot is, because you will see this again. The formula for cardiac index you will see again, and when you're troubleshooting the pulmonary artery catheter, please check for air bubbles in the transducer, aspirate or remove the clot, flush the catheter with saline, or most common on this exam is to rotate the catheter. And there you have it. Okay, guys. Hey, listen, there's a lot of information on this board that you will see again on your journey to becoming a registered respiratory therapist. Please take this information into consideration, and I can assure you it will help you on your very next attempt or on your very first attempt to become a respiratory therapist. I wish you well. Hey guys, listen, do me a favor. Hit that like button. Subscribe to my channel. Turn on your post notification bell, because I'm doing a video every single week. And until next time, we out.